Hi everyone, I'm Dr. Shabri Hassoor. I'm the GP with special interest in diabetes and physician working in the southwest of England. I'm also the medical director of Adisha Health. Now, today is day 3 of the Diabetes Awareness Week, and today we'll be talking about type 2 diabetes. So, what is type 2 diabetes? Now, as you know, the pancreas, which is the organ in your tummy, produces the hormone called insulin, and insulin is responsible to maintain a normal blood sugar. In type 2 diabetes, the blood sugars are high, and that's mainly because your body is not producing enough insulin, or the insulin which is produced is not effective because of the resistance, and mainly this is due to obesity. So, how common is diabetes? 5 million people are living in the UK with diabetes diagnosis. Now, 90% of the adults who are diagnosed with diabetes will have type 2 diabetes. So, type 2 diabetes is the most common diabetes. Majority of the times, type 2 diabetes is because of obesity. And the good news is 90% of the times it is preventable. In India, 77 million people have got diabetes. So, what increases your risk of developing type 2 diabetes? If you're white and above 40 years of age, or if you're about 25 years of age and belong to an ethnic minority in the UK, you're at higher risk. You are 2 to 4 times more likely to develop diabetes if you belong to the South Asian descent, or African, Caribbean, or Black African descent. So, which essentially means that Indians or Indian British are at 2 to 4 times higher risk of developing type 2 diabetes. If you have a first degree relative, that is your parents or brothers, sisters, or a child who suffers with type 2 diabetes, it increases your risk. If you have hypertension, that increases your risk. And obviously, if you're obese, that increases your risk of developing type 2 diabetes. What are the symptoms? Now, type 2 diabetes, a bit like pre-diabetes, especially during the initial stages of the disease, is completely asymptomatic. But as the disease progresses, you start having symptoms. Sometimes the symptoms might be where you are passing urine very frequently, especially in the night. You might be thirsty. You might be very hungry and wanting to eat all the time. You might have genital itching or thrush. Wounds and cuts will take more longer to heal. You can have blurred vision, and men, if listening, diabetes is one of the main causes of erectile dysfunction. So, how is diabetes diagnosed? As I've mentioned in my previous videos, the commonest blood test which is used nowadays is called HbA1c test, which is a blood test. You don't need to fast for this, and it looks at average 3 months of blood sugar in the last 3 months, that is. So this slide basically tells us about the treatment of type 2 diabetes. Now, every type of diabetes which I've mentioned in the past, and including type 2 diabetes, will need multidisciplinary team members to look after the patients. Majority of, I probably will say 90% of the type 2 diabetes is managed by the primary care or by GP surgery team. So you will have a phlebotomist or the healthcare assistants who do your bloods, your initial diabetes review. Then you will be seen by the diabetes nurses or the GPs with special interest in diabetes. You need to see the opticians or the people who are trained to do diabetic retinal screening. And when your diabetes becomes very complex, you might be looked after by community specialist diabetes nurses or consultant diabetologist or endocrinologist. The treatment mainly includes diet and exercise, oral diabetes medications, injectable diabetes medications, and insulin. I just want to add one important point here. When you get initially diagnosed, and sometimes even after a few years, you will be referred to a structured diabetes education. I really encourage everybody to attend that program because it's very informative and empowers you to look after your disease well. So coming to the oral diabetes medications, now few decades ago, it just used to be metformin or sulfonylureas and then insulin. However, many oral medications have now been used for the treatment of diabetes. I've just put the slides with the names of different classes of medications that is used currently. It gets very technical, so we won't get into each and every medication in this video, but of course, if people are interested, leave a message. My next videos can be about the medications. I will add here though is there are 8 diabetic processes which I encourage each and every person who has got a diagnosis of type 2 diabetes to get it done every year, and sometimes maybe more often depending on how well your blood sugars are controlled. The first one is weight, because as you know, obesity increases your risk, and also the obesity makes the amount of insulin that is produced ineffective. So you need to check your weight so that you know whether it is optimal weight or not. If not, what to do. Blood pressure check. Now, because the diabetes and blood pressure are risk factors for heart attacks, strokes, and many other chronic illnesses, it is important you check your blood pressure regularly. Next is smoking status. Again, another risk factor for heart attacks and strokes. You need to get your diabetic foot check done because the foot can because of the reduced circulation and also reduced sensation, sometimes you can have many problems. To avoid amputation, regular diabetic foot check is very important. Now, diabetic retinal screening, where they look at the back of the eye or the retina to see if, because of the high blood sugars, has any changes taken place. As I've mentioned in one of my videos, diabetes is the major cause of preventable sight loss or blindness. So it's really important that you get regular diabetic retinal screening. Next are blood tests. The most important one obviously is the HbA1c, which looks at your blood sugars. The others are kidney function test, lipid profile, and I would say lipid profile and liver function tests goes hand in hand, because if you want to treat a high cholesterol in a patient with diabetes, you need to know how their liver function is. And the last one is the urine ACR. This is an early morning urine sample that your GP surgery will ask. This mainly looks at whether you have started losing protein in your urine. And this is again an early indication that you might be, in a long run, might be developing kidney failure. So you have to make sure that you check for this, and if it is present, there is a certain types of treatments that we need to start. Now, this is the resource. This slide tells you about the Diabetes UK, and I can't say it enough. It is a really good resource. So there's a lot of information if you want to go and have a look. So take home message for type 2 diabetes is be aware of your risk factors and also the symptoms which people may have in type 2 diabetes. If you're suspicious, please go and get a blood test done from your GP surgery. If start, maintain or intensify your healthy lifestyle through diet, physical activity, and maintaining an optimal weight. Go to all your diabetes appointments, be it blood test, urine test, diabetes retinal screening or food check, your nurse's appointments. Please attend all of them. We do try and make it very sleek so that you don't lose a lot of time, especially because if you're in the working age group, it is very difficult to take time out to come and attend all these appointments. We completely understand that. And be regular with your medications which has been issued by the healthcare professionals. Take charge and be aware of the disease. Be aware how you can make a difference and look after your disease or live with diabetes well. I hope this video was informative for you. If you have liked it, please like, share and subscribe, and be ready to learn about the type 1 diabetes in my next video. Thank you.